Hello, this is Todd Perry. We're going to talk a little bit about knee replacements today, the steps that lead up to it, your options, and how to be successful with a knee replacement. Any discussion on knee replacement, we obviously start talking about the knee pain and what leads you to this discussion. Okay, there's meniscal tears that can happen in a knee, there's sprains, there's arthritis that can happen in a knee. There's also different types of arthritis. There's osteoarthritis, there's rheumatoid arthritis, there's post-traumatic arthritis. Osteoarthritis is the most common. That is the wear and tear arthritis that occurs in a knee as we just get older. Some people get lucky, they have great genetics and their cartilage lasts until they're 90. Other people in their 40s it starts to wear, and most people it's in their 60s. And once that cartilage layer wears away, that is the nice soft cushioning that is on the ends of the bone that keeps the ends nice and slippery, gives us that little cushioning pad and makes your knee comfortable and move like it should. As that wears away, the pain sets in, and that's what leads to basically these discussions and our options. We start with the simplest thing, Tylenol. Tylenol is the safest medication for this pain. It is very well tolerated by the body. And then if that doesn't work, we move on to anti-inflammatories, things like ibuprofen, things like Aleve. These that we've learned in the last couple of years are a little bit more dangerous, a little tougher on the kidneys, have some side effects, even some effects to the heart, but are very effective at the right dose in treating your osteoarthritis. Then we can move on to injections. That can be steroids that act as a really strong anti-inflammatory, calm it down, and based on the severity of your arthritis can last for anywhere from 2 weeks to 6 months. Injections with viscosupplementation, okay, or the oil, the lubricating shots that have had some success in knees. We can talk about the roles of that, where those have been successful, and when the knee is maybe too far gone to expect good results with those viscosupplementation injections. There's activity modifications. We can give up certain exercises that flare up our arthritic symptoms depending on where is the arthritis within our knee. We can talk about different exercises that may help us feel better with our arthritis, that maintain our mobility, maintain the endorphins being generated in the body that exercise can give us without flaring up that knee pain. All these things are very critical to kind of prolong your natural knee and delay that knee replacement as long as you can. Then we get to knee replacements. When all of these other things have failed and you find, hey, I'm not wanting to go out and walk with my spouse. I'm not wanting to go play with my grandkids. Nothing else has worked. We've gone through these other options. Then we talk about knee replacements. There are certain people that are candidates for a half knee replacement. Probably 15 to 25% of the population. Those that are a little bit more bow-legged are good candidates to have a half knee replacement. There are certain advantages to that if you are the right candidate. And then there's full knee replacements, when the knee is worn out in all three compartments, and we can talk about who benefits from that, what you can expect from that, what you can do to have the best results when you have your knee replacement. So we'll go through some of those things in the rest of this video. Look forward to the discussion.